So we are moving to the another topic, tubular-interstitial disease. So here the problem is tubules and interstitium. Between the tubules you have interstitium, that is get affected. These diseases are not common. Glomerular nephritis is so common when compared to the tubular-interstitial disease. The etiology is totally different. The tubules can get damaged in infections. Acute pyelonephritis, tubules can get damaged. Ischemia, that's another common cause, is not listed here, I don't know why. If someone develop less blood supply to the kidney due to hemorrhage or due to dehydration like diarrhea, then they can develop acute tubular necrosis. That's one of the common tubular disease, acute tubular necrosis. It's a reversible condition. Acute tubular necrosis is a reversible condition. Then there are non-infective causes of tubular interstitial disease. There are weird causes, like allergies. Some people develop allergic to penicillin and they develop tubular interstitial disease. Another common cause is non-steroidal anti-inflammatory drug abuse. The elderly people with rheumatoid arthritis, another arthritis, they abuse the NSAIDs. Then they can develop a renal problem. In Sri Lanka, as a normal doctor, what are the common things I have seen is, one is leptospirosis, the rat fever, that can cause tubular interstitial damage. Other thing I have seen is snake bite, can cause renal damage. Other common reason I have seen is a gentamicin toxicity, aminoglycoside, giving too much of aminoglycoside. Because aminoglycoside, two side effects. One is nephrotoxicity, other one is hearing problem, ototoxicity. Other rare reason is a multiple myeloma. So these are the weird causes of tubular interstitial disease. Another way of classifying this, tubular causes of tubular interstitial disease, allergies like penicillin and things, immune, autoimmune, transplant reaction, infection, already we have discussed, leptospira, bacterial pyelonephritis, toxin, multiple myeloma and things. But I'm more interested about this topic, acute tubular necrosis. Commonly caused by less blood supply to the kidney, renal ischemia. That's a common cause. But as I told you earlier, it can be caused by toxins like aminoglycoside, snake bite, contrast, infection, myoglobin. All these toxins can cause tubular necrosis. But common one is the ischemic one. But the difference is, in the ischemic one, only the parts of the tubules get necrosed, maybe proximal tubule only, or maybe the collecting duct only. But in toxic ATN, all tubules get necrosed. It's a severe form of necrosis. In acute tubular necrosis, urine you will get tubular cast or granular cast, and histology you will see a lot of edema in the interstitium and a lot of necrosis of tubular cells. But it's reversible. Most of the ATNs are reversible if you manage conservatively. So the difference between tubular disease and glomerular disease, obviously, in tubular disease, the main problem is, what's the main function of tubules? Basically, absorption and secretion. So that function is lost. So urine concentrating ability is lost in tubular disease. So urine will be diluted urine. So osmolality will be low. And sodium is not reabsorbed. You get a lot of sodium in the urine. Glomerular disease, mainly you will get proteinuria, hematuria, and RBC cast. Here you will get the granular cast or tubular cast. Treatment of glomerular disease is steroid. Treatment of tubular disease is just do a dialysis and supporting the patient. And if there's a toxin, remove the toxin. So that's the difference between tubular interstitial disease and the glomerular disease. Drug-induced interstitial nephritis, you will see a lot of eosinophils, and acute inflammatory cells. Papillary necrosis is also a kind of interstitial, tubular interstitial disease because collecting ducts are damaged. So you can see the cortex, medullary rays, and part of the papilla, the tip is damaged, papillary necrosis. The common cause I have seen is poorly controlled diabetes. I have seen so many patients. I have seen recently a patient passing the soft tissues in the urine, and we sent for a histology, and histology came as papillary necrosis. And recently I have seen 2 patients came with a ureteric colic. We did the CT scan, no stone. Ultimately, it was a papillary necrosis tissue piece obstructing the ureter. So it's common, poorly controlled diabetes. But there's a saying there's a mnemonic in the surgery postcard. P, pyelonephritis, O, obstruction, sickle cell disease, TB, cirrhosis, NSAIDs. All this can cause papillary necrosis. Here's another specimen, renal cortex. In medulla, you can see the papilla is necrosed. So these are minor calluses. You can see that. So that's the end of tubulo-interstitial disease. Just remember, it's not so common, but recoverable disease because tubules are made by stable cells rather than permanent cells like glomerulus. ATN is common, is recoverable disease. Thank you very much.